A-fib is a common heart rhythm problem that raises the risk of stroke. A new approach called pulse field ablation is changing how doctors treat it.
Physicians in Naples helped test this technology, another part of new clinical trials to make it even better. Reporter Amy Osher has more.
Love hanging out with our 6 grandchildren.
Michael Lee was enjoying life in Naples until one day his heart went haywire.
It just felt like my heart was really beating out of my chest.
It was caused by atrial fibrillation, or A-fib, a heart rhythm disorder that makes the heart beat fast and irregular.
Instead of having an organized rhythm from the upper chamber, the whole upper chamber is disorganized. It's chaotic.
That chaotic rhythm can cause blood to pool in the heart, raising the risk of stroke and raising concern for Michael.
I knew if you throw a blood clot and it goes to your lungs or heart, you're in trouble.
So he underwent an ablation procedure, treating A-fib by destroying the problematic heart tissue.
We're going after the triggers for A-fib, which means the tissue which is most unstable.
Michael's procedure utilized a new technology called pulse field ablation, delivering bursts of electrical energy. A wire-like catheter is threaded into the heart and guided to the trouble spot.
When the tip touches the tissue which we think is not desirable, we pass the current through that and almost like zapping the tissue.
Pulse field ablation is now a standard treatment, but Michael's surgery was cutting edge. NCH was part of the clinical trial for FDA approval, and Dr. Sharma is involved in new research to make the process even better.
Some studies are using different catheters which have some unique features.
Michael didn't spend a single night in the hospital and is back to doing the things he loves.
I was ready to, go kick a soccer ball.
Barely missing a beat. I'm Amy Osher reporting.
Unlike older treatments that used heat or freezing, pulse field ablation uses electrical pulses to target abnormal tissue while protecting healthy tissue nearby.